Yeah, that was my favorite part of the global health program. I think, yes, classes are great, and classroom knowledge and learning from textbooks is definitely fundamental to our degree, but having that required part where we had to go abroad put everything into perspective for me. I was able to understand how everything we learned, the complexities of global health, what does that actually look like on the ground? As background, I was in a rural village in Tanzania, East Africa. In that village called Tonga, I had the opportunity to live there for 4 months in a community that faced a lot of health challenges. One is definitely the medical supply shortages that I saw. Of course, we know about transportation being an issue for a lot of these patients, and for me, the work that I did was related to the antibiotic resistance for patients dealing with chronic wound infections. I did that quantitatively, but I also interviewed them, and I think that was where I got most of the rich content of what is it that they're facing in terms of the social determinants, which led to transportation, financial barriers. But I think the most interesting for me is that it reshaped my understanding of health innovation like completely. And what I mean by that is that, for example, a lot of the patients that I had included in my research had to get amputations, for example, because their chronic wound infections were long gone. When we're looking at an open wound or a fracture, or an open fracture, we have a paraffin adhesive, like an adhesive before you put the dressing over the wound. I remember one day a patient came in and we just didn't have any of the supplies to give them that adhesive, which is important, for recovery. In that moment, the physicians looked at a sterile catheter bag and cut it up, and it's basically a plastic adhesive now, and we use that before we put the dressing onto that patient, and it worked remarkably well. But it was in that time that I realized that coming from DC, going to a rural village, we hear innovation as like a buzzword, but for them it's reality. And so there I learned how innovation isn't necessarily about these advanced health technologies, but it's more so about the practical solutions that can impact that community, even if it's low cost, because if it has high impact, it's going to be beneficial for the community.